Now in West Africa, Ghanaian officials have introduced 2 new vaccines that are giving children hope for a healthier future.
The First Lady of Ghana, Dr. Ernestina Naadu-Mills, is administering a rotavirus vaccine to 6-week-old Queenstonia Nyamekie, marking the official launch of the vaccine in Ghana. The rotavirus and pneumococcal vaccines are both being added to the country's routine immunization program for children under the age of 5. Pneumonia and severe diarrhea caused by rotavirus accounts for approximately 20% of child deaths in Ghana. Dr. Mills says introducing the 2 vaccines is good news.
The suffering caused by pneumonia and diarrheal diseases among children is about to be significantly reduced with the introduction of the new vaccines. Our children and their families deserve every intervention we can offer to help fight vaccine-preventable and other diseases.
The World Health Organization says pneumonia and severe infant diarrhea kill more than 2.7 million children under the age of 5 worldwide each year. Both diseases are causing a great burden on families, communities, and countries in the underdeveloped world. The diseases also present major challenges toward achieving the Millennium Development Goal, MDG 4, set by world leaders to reduce by 2/3 between 1990 and 2015 the mortality rate among children under age 5. Ghana's Minister of Health, Dr. Alban Bagbin, says meeting the MDG 4 target is on his country's priorities.
It's important to indicate the country's commitment to achieving the Millennium Development Goal 4 and to fighting against Ghana's major under 5 killer diseases, namely pneumonia and diarrhea. Hence, our desire to take on these 2 vaccines at a go.
By introducing the 2 new vaccines together, Ghana has reached a major milestone. Ghana has become the first African country to introduce simultaneously the pneumococcal and rotavirus vaccines, tackling 2 of the biggest killers of children under 5 around the world. The vaccines have been financed by the Gavi Alliance. Gavi is a public-private partnership that funds bulk buy vaccination programs for poorer nations that cannot afford to pay the prices of developed countries. The government of Ghana has co-financed the vaccines. Dr. Seth Berkley, Gavi CEO, says Ghana has been approved to roll out 2 vaccines together, first because of its track record.
So it requires commitment from the entire government to make sure that there's adequate finance, there's adequate health workers, there's adequate stores and facilities and logistics to make these vaccines get available.
Dr. Kwame Amponsa Achiano, the project coordinator, says rolling out 2 new vaccines is not an easy task.
Introducing 2 new vaccines is one of the greatest challenges you would ever have in an immunization program. But with good planning and good coordination, it's not impossible. We had approval from Gavi late last year, and immediately after we started preparations. The actual work started somewhere last year, towards the end of last year. That is when the events were accelerated.
Ghana has 90% immunization coverage for infants. The 2 new vaccines bring to 11 the number of vaccines used in the country's regular immunization package, which include tetanus, measles, and polio. 2 more tools to keep children healthier and happier. Linord Moudou, VOA News, Accra, Ghana.
That's right, that was Linord Moudou reporting. Now, Linord's Health Living segment will air again on Friday instead of her usual Thursday slot. This is because this week she is traveling to Ghana, where she will report to us on the 2nd Susan G. Komen Ghana Race for the Cure. The event is a collaboration between Breast Care International and the Susan G. Komen organization and will take place in Kumasi on Friday. Linord will join us on Friday with coverage of the day's activities.